So today we are discussing about pharynx. So pharynx, it is a musculo-membranous tube which extends from the base of the skull to the level of 6 cervical vertebra. So it is a musculo-membranous tube which extends from the base of the skull to the lower border of 6th cervical vertebra. And here the pharynx, it is divided into 3 parts. Nasopharynx, which is present behind the nasal cavity, oropharynx, which is present behind the oral cavity, and laryngopharynx, which is present behind the larynx. So the pharynx, it is divided into 3 parts: nasopharynx, oropharynx, and laryngopharynx. So the pharynx, it is about 12 mm in length, and its diameter at the nasopharynx is about 3.4 mm and width, and it is narrower at the pharyngoesophageal junction. At the pharyngoesophageal junction, the width of the pharynx decreases, and the maximum width of the pharynx we can see at the nasopharynx. So the pharynx, it is a musculo-membranous tube which extends from the base of the skull to the lower border of 6 cervical vertebra, and where it is continuous as the esophagus. The pharynx, it is divided into 3 parts by its position. Nasopharynx, which is in contact, which is present behind the nasal cavity; oropharynx, which is present behind the oral cavity; and laryngopharynx, which is present behind the larynx. So coming to the external relations of the pharynx, above it is bounded by the basilar part of the occipital bones, sphenoid part, and anterior arch of atlas. Above it is bounded by the basilar part of the occipital bone. This is the sphenoid bone. This is the sphenoid bone, and this is called sphenoidal aid sinus. This is the sphenoidal aid sinus. Above it is bounded by the basilar part of occipital bone, sphenoidal aid sinus, and also anterior arch of atlas. And coming to the below it is continuous with the esophagus at the pharyngoesophageal junction at the level of C6 vertebra. At the level of C6 vertebra, the pharynx continues as the esophagus. And coming to the anterior, it is related to the nasopharynx through choanae, oropharynx through oropharyngeal isthmus, and laryngopharynx, it communicates with the laryngopharynx through laryngeal inlet. So above it is bounded by the basilar part of the occipital bone, sphenoidal aid sinus, and anterior arch of atlas. Below it is continuous with the esophagus at the pharyngoesophageal junction. And coming to the anteriorly, it communicates with the nasal cavity through choanae, oral cavity through oropharyngeal isthmus, and laryngeal cavity through laryngeal inlet. This is the laryngeal inlet, and this is the oropharyngeal isthmus, and here is the choanae. So it communicates anteriorly with the nasal cavity through choanae, through oral cavity through oropharyngeal isthmus, and laryngeal cavity through laryngeal inlet. Coming to the boundaries, and also behind the pharynx, it is supported by the upper 6 cervical vertebra, as well as pre and paravertebral muscles. And also these pre and paravertebral muscles, we know that it is covered by prevertebral fascia and also retropharyngeal space and its contents. So behind it is supported by the upper 6 cervical vertebra, and also pre and paravertebral muscles which covers the vertebra, and also retropharyngeal recess. So behind it is related to the upper 6 cervical vertebra, pre and paravertebral muscles which covers the cervical vertebrae, and retropharyngeal space and its contents. Retropharyngeal space and its contents, those forms the behind relations of the pharynx. And coming to the lateral relations of the pharynx, it is related to the styloid process of temporal bone. We know that styloid process of temporal bone gives rise to styloid groups of muscles, styloglossus, stylopharyngeus muscles, and it is related to styloid groups of muscles. And also the lateral wall of the pharynx, it is also related to carotid sheath and its contents. We know that in carotid sheath we have common carotid artery, we have common carotid artery along with internal carotid artery, and also internal jugular vein and vagus nerve. Those forms the lateral relations, and these are the lateral relations of the pharynx. So the pharynx, it is bounded above by the basilar part of the occipital bone and also sphenoid bone and also anterior arch of atlas, and behind, and coming to the behind relations, it is related to the upper 6 cervical vertebrae and also pre and paravertebral muscles which are covered by the prevertebral fascia. And coming to the in front, it communicates with the nasal cavity through choanae, oral cavity through oropharyngeal isthmus, and laryngeal cavity through laryngeal inlet. Below it is continuous with the esophagus, and coming to the esophagus at the pharyngeoesophageal junction at the level of C6, and coming to the lateral wall relations, it is related to the carotid sheath and its contents and styloid groups of muscles, and also lateral lobe of thyroid gland. It is also related to the lateral lobe of thyroid gland. So this comes under the lateral relations of the pharynx. And coming to the nasopharynx. So the nasopharynx, it is situated behind the nasal cavity. So this part we call it as nasopharynx. So this is called nasopharynx. So the anterior wall of the nasopharynx, it is free and it is communicates with the nasal cavity through choanae. And above the nasopharynx, roof and posterior wall of the nasopharynx, it is formed by the basilar part of the occipital bone as well as the sphenoid bone as well as the anterior arch of atlas. They form the roof and posterior wall. So the roof and posterior wall are continuous. This is the nasopharynx. Here the anterior wall, it communicates with the nasal cavity through choanae, and coming to the roof it is formed by the basilar part of the occipital bone, sphenoid bone and anterior arch of atlas. Here in the roof and posterior wall, we will able to see nasopharyngeal tonsil. Here this is the nasopharyngeal tonsil. Nasopharyngeal tonsil is nothing but the aggregation of the lymphoid tissue. So nasopharyngeal tonsil is nothing but the aggregation of the lymphoid tissue. Sometimes this nasopharyngeal tonsil swells due to infection and we call it as adenoid. The nasopharyngeal tonsil, it swells due to infection, we call it as adenoid. So this adenoid blocks the nasal passage, so mouth respiration is obligatory if the adenoid swelling takes place. So in the roof and posterior wall, we have seen a nasopharyngeal tonsil, which is nothing but the aggregation of lymphoid tissue, and here sometimes this nasopharyngeal tonsil is swells due to infection. We call it as adenoid. So this adenoid, they block the respiratory passage so that the mouth passage. So we have to take the respiration through mouth. We have to take the oxygen through mouth, which is obligatory. Due to the presence of adenoid, they block the respiratory passage. Okay, so that's about the nasopharyngeal tonsil, which is present in the roof and posterior wall of the nasopharynx. And coming to the floor of the nasopharynx, it communicates with the oropharynx through oropharyngeal isthmus. So this is the oropharyngeal isthmus. So the floor of the nasopharynx communicates with the oropharynx. So this is the nasopharynx, oropharynx, and this is the laryngopharynx. So the floor of the nasopharynx communicates with the oropharynx through oropharyngeal isthmus. This is the pharyngeal isthmus. This is the pharyngeal isthmus, which is bounded in front by the soft palate, behind by the Passavent's ridge caused by the Passavent's sphincter by the palatopharyngeus muscle. So behind, in front by the soft palate, behind by the Passavent ridge, which is nothing but a mucus depression situated behind the salpingopharyngeal fold. So this is the pharyngeal isthmus, which is bounded in front by the soft palate, behind by the Passavent's ridge. It is a mucus elevation situated behind the salpingopharyngeal fold. So this is the pharyngeal isthmus. This pharyngeal isthmus is closed during deglutition. This pharyngeal isthmus is closed during deglutition or blowing of air through the mouth. This pharyngeal isthmus will be closed. So roof and posterior wall consists of nasopharyngeal tonsil, and from the nasopharyngeal tonsil, it is nothing but the aggregation of the lymphoid tissue. Sometimes this nasopharyngeal tonsil swells, we call it as adenoid, which blocks the nasal passage. So mouth passage, we have to take respiration through mouth, which is obligatory due to the infection of the nasopharyngeal tonsil. And behind we have seen a mucus diverticulum here. This is called pharyngeal bursa. This we have to take a mucus we have seen a mucus diaviculum which extends into the nasopharyngeal tonsil. We call it as pharyngeal bursa. This pharyngeal bursa, it is nothing but a mucus diaviculum. Sometimes the mouth of the pharyngeal bursa is closed and it forms a cystic swelling in the nasopharyngeal tonsil. This is the pharyngeal bursa. It extends into the nasopharyngeal tonsil. It extends into the nasopharyngeal tonsil. Sometimes the mouth of the bursa is closed, forming a cystic swelling. And one more thing is, this pharyngeal bursa is nothing but the remnant of the rotochord on the dorsal wall of the pharyngeal part of the foregut. So this is pharyngeal bursa is nothing but the notochordal cells, notochord on the dorsal wall of the pharyngeal part of the foregut embryologically. Sometimes this pharyngeal bursa undergoes quadrification and undergoes because cartilization due to presence of the calcification of the notochordal cells. So in the roof and posterior wall, we will able to see the pharyngeal tonsil, and also pharyngeal bursa. It is a mucus diaviculum which extends into the substance of the nasopharyngeal tonsil. Sometimes the mouth of the pharyngeal bursa is closed, forming a cystic swelling. Pharyngeal bursa is nothing but the remnant of the notochord which is attached to the dorsal wall of the pharyngeal part of the foregut. That's about the roof and posterior wall. Floor, it communicates with the oropharynx through pharyngeal isthmus, which is bounded in front by the palate and behind by the passavans ridge. It is a mucous elevation situated on the beside the salpingopharyngeal fossa. This is the passavans. It is a mucous elevation which is formed by the passavans muscle, nothing but the palatopharyngeus muscle, which is a part of the palatopharyngeus muscle. So this is the passavans ridge and this is the pharyngeal isthmus. So next, coming to the lateral wall. Coming to the lateral wall of the nasopharynx. In the lateral wall of the nasopharynx, one important opening is seen, that is called auditory tube opening. This auditory tube, it opens into the anterior wall of the tympanic membrane. So we can see the opening of the auditory tube. This auditory tube extends from the anterior wall of the tympanic membrane and opens into the lateral wall of the nasopharynx. It maintains the equilibrium of air pressure of the tympanic membrane for proper vibrations of sounds. So auditory tube opening is seen in the lateral wall of the nasopharynx. This auditory tube opening is situated 1.25 centimeters above and slightly below, 1.2 centimeters behind and slightly below the inferior nasal concha. So this is the inferior nasal concha. It is situated 1.25 centimeters behind and slightly below the inferior nasal concha. This is the auditory tube opening which communicates with the anterior wall of the tympanic cavity and maintains the equilibrium of the air pressure of the tympanic membrane. So this is the opening of the auditory tube. The opening of the auditory tube, it is guarded by a tubal elevation. We call it is surrounded roof and posterior wall of the auditory tube. It is surrounded by a tubal elevation. This is called tubal elevation. From the tubal elevation, two folds extends, that is salpingopalatine fold and salpingopharyngeal fold. Salpingopalatine fold which extends to the palate and salpingopharyngeal fold which extends into the pharynx, which consists of the muscle of the same name. Behind the salpingopharyngeal fold, we have salpingopharyngeal muscle, which is nothing but the longitudinal muscle of the pharynx. So on the lateral wall of the nasopharynx, we have seen the opening of the auditory tube, and upon the opening of the auditory tube, we have roof and posterior wall of the auditory tube opening. We have seen a tubal elevation. On the tubal elevation, we will see some tonsils are present on the tubal elevation. We call them as tubal tonsils. We call them as tubal tonsils, nothing but the aggregation of lymphoid tissue. From the tubal elevation, two mucous folds extend, that is called salpingopalatine fold. This is salpingopalatine fold and this is salpingopharyngeal. This is salpingopharyngeal fold. This is salpingopharyngeal fold and this is salpingopalatine fold. See, we can see this is the salpingopharyngeal fold and this is salpingopalatine fold. So that is about the lateral wall of the nasopharynx. So the nasopharynx, anterior wall of the nasopharynx, it is free and it is communicates with the nasal cavity through choanae. Posterior wall, roof and posterior wall of the nasopharynx, it is formed by the basilar part of the occipital bone, sphenoid bone and anterior arch of atlas. This is the roof and posterior wall. They are both continuous with each other. Coming in the roof and posterior wall, we will able to see the nasopharyngeal tonsil, which is nothing but the aggregation of the lymphoid tissue, and a mucus diverticulum extends into the nasopharyngeal tonsil, we call it as pharyngeal bursa. And this nasopharyngeal tonsils, sometimes it causes due to infection, it swells, forming adenoid, blocking the nasal part, which so that mouth respiration is obligatory. And also the mucus diverticulum, the mouth of the mucus diverticulum, nothing but the pharyngeal fossa is cut and it forms a cystic swelling. It is nothing but the remnant of the notochord which is attached to the dorsal wall of the pharyngeal part of the foregut. Sometimes this pharyngeal bursa undergo calcification and ossification. That's about the roof and posterior wall. Coming to the floor, it is communicates with the floor of the nasopharynx communicates with the oropharynx through pharyngeal isthmus, which is bounded in front by the soft palate. We know that this is hard palate and this is soft palate. This is also the pharyngeal isthmus, which is bounded in front by the soft palate, behind by the pessavel string. This is nothing but a mucus elevation caused by the pessavel muscle, which is nothing but a part of palatopharyngeus muscle. And coming to the lateral wall of the nasopharynx consists of an important tube opening that is called auditory tube opening, which is bounded by an elevation called tubal elevation. Auditory tube opening, it communicates with the anterior wall of the tympanic cavity to the lateral wall of the nasopharynx, which maintains the equilibrium of the air pressure of the tympanic membrane for the proper vibrations of sounds. So, and it is guarded by tubal elevation. The opening of the auditory tube, it is bounded roof and posterior part of the opening of the auditory tube consists of a tubal elevation, we call it, and on the tubal elevation we will able to see tubal tonsils are present. From the tubal elevation, two folds extend, that is salpingo palatine fold and salpingopharyngeal fold. Salpingopharyngeal fold consists of the muscle. Behind the salpingopharyngeal fold, we can consist of the muscle of the same name, that is nothing but the salpingopharyngeal muscle. That's about the lateral wall of the nasopharynx. And also behind the salpingopharyngeal fold, we will able to see a recess. Is nothing but a mucus depression. Behind the salpingopharyngeal fold, we will able to see a recess here. That is, this one we call it as pharyngeal recess. Pharyngeal recess is a mucus depression behind the salpingopharyngeal fold, and sometimes the nasopharyngeal tonsil extends into this recess. Sometimes the nasopharyngeal tonsil extends into this recess. This is nothing but the pharyngeal recess which is present behind the nasopharyngeal fold. Is nothing but the mucus depression present behind the nasopharyngeal fold, and sometimes salpingopharyngeal fold, and sometimes the nasopharyngeal tonsil extends into the pharyngeal recess. This is called pharyngeal recess. And one more thing is here, sometimes in the roof we will able to see pharyngeal hypophyses are seen. We can see it is similar to pharyngeal hypophyses. Pharyngeal hypophysis is seen on the roof of the nasopharynx. Pharyngeal hypophysis is seen on the roof of the nasopharynx, because this pharyngeal hypophysis is nothing, it is similar to that of adenohypophysis, nothing but the pituitary gland. Similar to the structure of the adenohypophysis, it is nothing but the extension of the stomatodium of the rectus pouch. It is an extension of the stomatodium of the rectus pouch. Pharyngeal hypophysis is seen in the roof of the nasopharynx. It is similar to that of the adenohypophysis. Here we have hypophyseal fossa is there. This is the hypophyseal fossa which lodges the pituitary gland, and here we have pharyngeal hypophysis is present on the nasopharynx. Pharyngeal hypophysis is similar to that of the adenohypophysis. It is nothing but it is a backward extension of the stomatodium of the rectus pouch. So that's about the pharyngeal hypophysis. That's about the nasopharynx. So roof, posterior wall, and also anterior wall, behind and below. So these are the relations of the nasopharynx. And coming to the oropharynx. So the oropharynx, it is communicates with the oral cavity through oropharyngeal isthmus. So the oropharynx, this is the oropharynx, this is the oral cavity, this is the tongue here. This is the hard palate, soft palate, this is the tongue, and this is the mandible here, this is the mandible, this is the tongue. So this is the genioglossus muscle, mylohyoid muscle and genohyoid muscle. So here this is the oral cavity, this is the oral cavity. So pharynx, this tube we call it as pharynx. The pharynx communicates with the oral cavity through oropharyngeal isthmus. So this is the oropharyngeal isthmus, which is bounded above by the soft palate, which is bounded above by the soft. This is the oropharyngeal isthmus, which is bounded above by the soft palate, below by the posterior 1/3 of the tongue, below by the posterior 1/3 of the tongue, above by the soft palate, below by the posterior 1/3 of the tongue. These are the boundaries of the oropharyngeal isthmus. These are the boundaries of the oropharyngeal isthmus. And here in the oropharyngeal isthmus, on the lateral wall of the oropharyngeal isthmus, we will able to see the palatine tonsil. This is the palatine tonsil is there, which is nothing but the aggregation of lymphoid tissue. Palatine tonsil in front, it is bounded by the palatoglossal arch. So this is palatoglossal arch. And behind we have palatopharyngeal arch. Behind we have palatopharyngeal arch. So we can see the palatine tonsil here. Palatine tonsil, it is present in a depression called tonsillar fossa, which is bounded in front by the palatoglossal arch and behind by the palatopharyngeal arch. Apex is formed by the soft palate where these two arches meet. Below it is formed by the dorsal surface of the tongue, posterior 1/3 of the tongue. Below it is formed by the posterior 1/3 of the tongue. So the palatine tonsil is present in the lateral wall of the oropharynx, which is bounded in front by the palatoglossal arch, behind by the palatopharyngeal arch. Apex is formed. Apex is formed by the where the two arches meet by the soft palate. Below we have dorsal surface of the tongue. That is the boundaries of the soft palate, and the lateral wall of the soft palate is also formed by the styloglossus and the superior constrictor muscles, which are covered by the and also pharyngobasilar fascia that forms the lateral wall of the tonsil. And here this tonsil we call it as, it is nothing but the aggregation of lymphoid tissue. And below the palatoglossal arch we have palatoglossal muscle is there, and behind the palatopharyngeal arch we have palatopharyngeal muscle is present. So that about the lateral wall of the oropharynx, it is bounded behind by the C2 and C3 vertebrae. It is bounded behind the oropharynx, it is bounded behind by the C2 and C3 vertebra. It communicates with the nasopharynx through pharyngeal isthmus, and here the oropharynx, it communicates with the oral cavity through oropharyngeal isthmus. So those are the boundaries of the oropharynx, and also the lateral wall of the oropharynx consists of tonsillar fossa, which lodges the palatine tonsil. That's about the oropharynx. And coming to the laryngopharynx. So the laryngopharynx here in the upper part, it communicates with the larynx through laryngeal inlet. So this is the laryngeal inlet, and here this laryngeal inlet, it is bounded above by, this is the epiglottis. It is bounded in front and above by the epiglottic, and below by the interarytenoid fold of mucous membrane. These are the arytenoid cartilages. These are the arytenoid cartilage, and this is the cricoid cartilage. This is the cricoid cartilage. This is also anterior arch of cricoid cartilage, and this is the posterior arch of cricoid cartilage. And we have thyroid cartilage here. This is the thyroid cartilage. So laryngeal inlet, which is bounded above by the epiglottis. This is the epiglottis. This one is the epiglottis. This is bounded above by the epiglottis, below by the interarytenoid fold of mucous membrane, and on either side by the array epiglottic fold. On either side by the array epiglottic fold. So the pharynx communicates with the larynx in the upper part through the laryngeal inlet, which is bounded by the free end of the epiglottis above and also anteriorly, and below it is formed by the interarytenoid cartilage, interarytenoid fold of mucous membrane, and also on either side by the array epiglottic fold. This is the array epiglottic fold. This one is the epiglottic fold, epiglottic fold. So this is the boundaries of the laryngeal inlet, and also the remaining part of the pharynx, it is covered by the mucous membrane, and below the laryngeal inlet, and consists of some cartilages are there in front of the pharynx. We have arytenoid cartilage is there, cricoid cartilage is there, and coming to the pyriform fossa. This is the pyriform fossa. Coming to the pyriform fossa. So the lateral wall of the laryngeal inlet. Behind the laryngeal inlet, we have pyriform fossa is there. Pyriform fossa is nothing but a mucus depression present behind the laryngeal inlet. This pyriform fossa, it is more deep in ruminating animals, and this pyriform fossa acts as a catch for foreign bodies. It acts as a catch point of foreign body. This is the pyriform fossa which present, it is the nothing but the laryngeal inlet. This is the laryngeal inlet, and here we have array epiglottic folds. These are the array epiglottic fold. On either side of the array epiglottic fold, we have pyriform fossa, which is a mucus depression. It acts as a catch point of the foreign body, and also it is more deep in ruminating animals. And one more thing is, this pyriform fossa, it is separated from the above part, from the tongue region, by the pharyngo-epiglottic fold. This is the pyriform fossa. Okay, so that's about the pyriform fossa. So in the laryngopharynx, this laryngopharynx, it communicates with the larynx through laryngeal inlet, which is bounded in front and above by the epiglottis, and below by the interarytenoid fold of mucous membrane, on either sides by the arrow-epiglottic fold. This is the array-epiglottic fold. This is array on either sides by the array-epiglottic fold, and below the laryngeal inlet, the pharynx, it is covered by the mucous membrane just behind the cartilages, and here on lateral to the array epiglottic fold, on either or behind the array epiglottic fold, we have a fossa called pyriform fossa. Pyriform fossa, it acts as a catch point of the foreign particle. It is more deep in the ruminating animals. Here this is the laryngeal inlet, on either sides by the array epiglottic fold. We have pyriform fossa here, which is situated behind the on either side of the array epiglottic fold. Thus about the laryngopharynx, and here the pharynx, it is bounded behind by the C5 and C6 vertebra. Here it is bounded by the C5 and C6 vertebra. So that's about the boundaries of the laryngopharynx. That's about the boundaries of the laryngopharynx, and the contents here is the pyriform fossa. So that's about the pharynx, interior of the pharynx. So nasopharynx, oropharynx, and laryngopharynx. Nasopharynx, important structures we will see is the nasopharyngeal tonsil, and also a mucous diverticulum called pharyngeal bursa. Nasopharyngeal tonsil infects during and forms adenoid, which causes the blockage of the nasal respiration, and the mouth respiration is obligatory. And here we can see in the lateral wall, we can see the tubal tonsil. Which is present on the tubal elevation, and here the important point is the auditory tube opening, which communicates with the anterior wall of the tympanic cavity to the lateral wall of the nasopharynx. And here from the tubal tonsil, from the tubal elevation, we can see two folds, salpingo-palatine fold and salpingo-pharyngeal fold are seen. And also on behind the salpingo-pharyngeal fold, we can see a mucous depression called pharyngeal recess. Sometimes the nasopharyngeal tonsil extends into the pharyngeal recess. That's about the nasopharynx. And also the nasopharynx communicates with the oropharynx through pharyngeal isthmus, which is bounded in front by the soft palate, behind by the passavens ridge. And coming to the oropharynx, it is communicates with the oral cavity through oropharyngeal isthmus, which is bounded above by the soft palate, below by the dorsal 1/3 of the tongue, on either sides by the palatoglossal and palatopharyngeal arches. And here on the lateral wall of the oropharynx, we will able to see palatonsillar fossa, which is bounded in front by the palatoglossal arch, behind by the palatopharyngeal arch, and also the tonsillar fossa, it is apex is formed by the where the two arches can meet by the soft palate, and where the two arches can meet, and below it is formed by the dorsal part of the tongue. And the oropharynx, it is related to the C3 and C4 vertebra. It is related to C3 and C4 vertebra. And coming to the laryngopharynx, it communicates with the larynx to the laryngeal inlet, which is bounded above by the epiglottis and below by the interarytenoid fold of mucous membrane. This is the arytenoid cartilage here, and also array epiglottic fold on either sides. And one more thing is, we have in the on either side of the areoepiglottic fold, we will able to see the pyriform fossa, which is a depression, mucus depression on either side of the areoepiglottic fold. And in the pyriform fossa, it is more deep in ruminating animals, and it is acts as a catch point of foreign bodies. So that's about the pharynx, nasopharynx, oropharynx and laryngopharynx. Nasopharynx communicates present behind the nasal cavity, oropharynx present behind the oral cavity, and laryngopharynx present behind the larynx. Nasopharynx communicates with the nasal cavity through choanae, oropharynx communicates with the oral cavity through oropharyngeal isthmus, and laryngopharynx communicates with the larynx through laryngeal inlet. So that's about the interior of the pharynx. Coming to the muscles of the pharynx, the pharynx has outer muscular coat which is made up of circular muscle fibers and inner longitudinal coat. Coming to the circular muscle coat of pharynx, we have superior constrictor muscle, middle constrictor muscle and inferior constrictor muscles. All the three constrictors of pharynx, they are covered by a loose areolar tissue, nothing but the buccopharyngeal fascia, which extends from the base of the skull, and it is nothing but the epimysium of the muscle. It is ill-defined. It is all the constrictor muscles of the pharynx, they are covered by the buccopharyngeal fascia, which is nothing but the loose areolar membrane which extends from the base of the skull, and it is ill-defined, and it so because of this ill-defined layer, very thin layer, the pharynx can be expanded easily. So coming to the muscle coat, circular muscle coat of pharynx, we have three constrictors are present: superior constrictor, middle constrictor and inferior constrictor. Coming to the superior constrictor, this superior constrictor, it is arises from the, here we can see the pterygoid plates here. This is the medial pterygoid plate and this is the lateral pterygoid plate, and from the medial pterygoid, from the lower and posterior border of the medial pterygoid plate, here we can see the medial pterygoid plate here, and this is the lateral pterygoid plate. From the lower and posterior border of the medial pterygoid plate, pterygoid hamulus and the pterygomandibular raphe, and also it arises from the side of the tongue. So those are the origins of the superior constrictor. So it arises from the medial and posterior border of the medial pterygoid plate. Pterygoid hamulus is a bony projection from the lower part of the medial pterygoid plate which gives attachment to the pterygomandibular raphe. So pterygoid plate, medial pterygoid plate, lower and posterior border, pterygoid hamulus. From the pterygoid hamulus we have pterygomandibular raphe arises from pterygomandibular raphe, and the posterior part of the mylohyoid line. On the inner surface, on the medial surface of the mandible, we have mylohyoid line is present. On the posterior surface of the mylohyoid line, and also from the side of the tongue, these are the origins of the superior constrictor muscle. So the superior constrictor muscle, it arises from the pterygoid hamulus here, pterygoid plate is here, pterygoid hamulus which gives attachment to the pterygomandibular raphe. So this is the pterygomandibular raphe. See here is the pterygomandibular raphe. It arises from the pterygomandibular raphe which arises from the pterygoid hamulus, and also the posterior part of the mylohyoid line. Posterior part of the mylohyoid line is present on the medial surface of the mandible, and here is the posterior part of the mylohyoid line. This is the posterior part of the mylohyoid line, and also from the side of the tongue. These are the origins of the superior constrictor. Coming to the insertion, all the constrictors of pharynx, not only superior constrictor of pharynx, all the constrictors of pharynx, they are inserted onto the median raphe. They are inserted on the posterior wall of the pharynx at the median raphe which extends from the pharyngeal tubercle. So here is the pharyngeal tubercle. We can see the pharyngeal tubercle here which extends from the pharyngeal tubercle to the pharyngoesophageal junction. So a median raphe is present which extends from the pharyngeal tubercle. Here is the pharyngeal tubercle. We can see the pharyngeal tubercle here. So this is the pharyngeal tubercle. So the median raphe, above it is attached to the pharyngeal tubercle and it extends up to the pharyngoesophageal junction. So the superior constrictor muscles, they are inserted. The upper fibers, they are inserted to the pharyngeal tubercles. The intermediate fibers, they are horizontal and they are inserted to the median raphe, and the inferior fibers, the lower fibers, they are also inserted, they extend downwards and backwards, they also inserted to the median raphe, where the inferior fibers or the lowest fibers, they are overlapped by the fibers of the middle constrictor. Here the lower fibers of the superior constrictor, they are overlapped by the middle constrictor fibers, the upper fibers of the middle constrictor. So the superior constrictor muscle, it is attached to the superior fibers, they are attached to the pharyngeal tubercle here, and the middle fibers, they are attached to the median raphe here, and the inferior fibers, they are overlapped by the upper fibers of the inferior constrictor. Here the constrictors of the constrictors, they overlap each other. That means the lowest fibers of the superior constrictor overlapped by the upper fibers of middle constrictor, as well as the lower fibers of the middle constrictor, they are overlapped by the upper fibers of the inferior constrictor. So the constrictors, they overlap with each other. And coming to the one more important point, the between the upper border of muscle and base of the skull, we have a place is present. With this place we call it as sinus of Morgagni. This place we call it as sinus of Morgagni is present. Sinus of Morgagni is present between the upper border of superior constrictor muscle and the base of the skull. This is called sinus of Morgagni, and this sinus of Morgagni, it is covered by the buccopharyngeal fascia as well as the pharyngobasilar fascia. Pharyngobasilar fascia is nothing but the submucous layer of the pharyngeal coat. This is nothing but the submucous layer of the pharyngeal coat. We can see the pharyngobasilar fascia and buccopharyngeal fascia covered the sinus of Morgagni. So this is the about the sinus of Morgagni. And coming to the middle constrictor muscle, it takes origin from the inferior and lesser and greater cornu of the hyoid bone. We know that hyoid bone, it is having greater cornu as well as lesser cornu. These are the greater cornu of the hyoid bone. These two are the lesser cornu of the hyoid bone. So the middle constrictor takes origin from the greater cornu as well as lesser cornu of the hyoid bone, as well as from the stylohyoid ligament. We have stylohyoid ligament is present, and it also takes origin from the stylohyoid ligament. So the lower part of the stylohyoid, it takes origin from the lower part of the stylohyoid ligament as well as the lesser and greater cornu of the hyoid bone. So here the upper fibers of the inferior constrictor, they overlap the lower fibers of the superior constrictor. So, and coming to the lower fibers, they extend downwards and backwards, and they are also inserted to the median raphe like the superior constrictor. And here there exists a space between the superior constrictor muscle and inferior constrictor muscle. So that's about the middle constrictor muscle. The middle constrictor muscle arises from the greater cornu as well as lesser cornu of the body of the hyoid bone, and also from the lower part of the stylohyoid ligament. It is inserted on backward to the median raphe. The upper fibers, they overlap the lower fibers of the superior constrictor, whereas the lower fibers of the middle constrictor, they are overlapped by the upper fibers of the inferior constrictor. So that's about the middle constrictor muscle, which is the one of the muscle of the circular coat of the pharynx. And coming to the inferior constrictor muscle, though this is the inferior constrictor muscle of the pharynx. So the inferior constrictor muscle of pharynx, it is having two parts, thyropharyngeus part and cricopharyngeus part. This is the cricopharyngeus part. The thyropharyngeus part of inferior constrictor. So this is the inferior constrictor muscle, right? So this is the inferior constrictor muscle. Inferior constrictor muscle. So it is having two parts. Look here. So this is having two parts, thyropharyngeus part, and this is the cricopharyngeus part. Thyropharyngeus part, it arises from the oblique line of thyroid cartilage. On the either side of the thyroid cartilage, we have oblique line. So this is the thyroid cartilage. On either side of the thyroid cartilage, we have oblique line. This is nothing but thyroid cartilage, the cartilage of larynx. On either side of the thyroid cartilage, we have an oblique line. So the thyropharyngeus part of inferior constrictor takes origin from the oblique line of the thyroid cartilage. And coming to the cricopharyngeus part of the inferior constrictor, it arises from the cricoid cartilage, anterior. So this is the cricoid cartilage. So this is the cricoid cartilage. And this cricopharyngeus part arises from the anterior arch of the cricoid cartilage and also from the tendinous arch of the cricothyroid muscle. So the cricothyroid muscle is here, and we are having a tendinous arch is here, and also it arises from the tendinous arch of the cricothyroid muscle. That is the origin of the cricopharyngeus part of the inferior constrictor. So the inferior constrictor is having two parts, thyropharyngeal part and cricopharyngeal part. Thyropharyngeal part arises from the oblique line of the thyroid cartilage, and cricopharyngeal part arises from the anterior arch of the cricoid cartilage as well as the tendinous arch of the cricothyroid muscle. Here we can see between the thyropharyngeus part and cricopharyngeus part we have one weak area is present. This is called Killen's dehiscence. This space we call it as Killen's dehiscence. This is a space, we call it as Killen's dehiscence. This is the weak part of the pharynx. This is the weak part which is present between the thyropharyngeus part as well as the cricopharyngeal part. This is called Killen's dehiscence, which is the weak part of the pharynx. Above the Killen's dehiscence, all the three constrictors are present, and below the Killen's dehiscence, only the cricopharyngeal part of the inferior constrictor is only present. And this is the weak part of the pharynx. This is called Killen's dehiscence. So that's about the constrictor muscles of the pharynx. The superior constrictor muscle, it arises from the posterior lower border of the medial pterygoid plate. I have shown you the medial pterygoid plate here. So this is the medial pterygoid plate, and this is the lateral. This is the medial pterygoid plate here, and this is the lateral pterygoid plate here. From the lower and posterior border of medial pterygoid plate, on the lower part of the medial pterygoid plate we have a spinal like projection is present. This we call it as pterygoid hamulus, which gives rise to pterygomandibular raphe. So the superior constrictor muscle arises from the pterygoid hamulus and also from the pterygomandibular raphe, which separates the buccinator from the superior constrictor, and also from the posterior part of the mylohyoid line. We have mylohyoid line is here, and the posterior part of the mylohyoid line, and also from the side of the tongue. That is the origin of the superior constrictor. And coming to the insertion of the superior constrictor, upper fibers they are inserted to the pharyngeal tubercle at the base of the skull, and the middle fibers they pass horizontally and are inserted to the median raphe, and the lower fibers they also extend backwards and downwards and overlapped by the upper fibers of inferior constrictor. They are also inserted to the median raphe, which is present on the posterior wall of the pharynx. This median raphe, all the three constrictors they are inserted to the median raphe, which extends from the base of the skull to the pharyngoesophageal junction. And between the upper border of the muscle, superior constrictor muscle, and the base of the skull, we have space, we call it as sinus of Morgagni. This sinus of Morgagni, it is covered by buccopharyngeal fascia as well as pharyngobasilar fascia. And one more thing is middle constrictor muscle. Middle constrictor muscle, it is overlapped the lower fibers of the superior constrictor muscle. Here the middle constrictor muscle, it arises from the greater cornu as well as lesser cornu, from the body of the hyoid bone as well as from the lower part of the stylohyoid ligament. Like other constrictor muscle, it is also inserted to the back of the median raphe or the posterior wall of pharynx. Here the lowest fibers of the middle constrictor they are overlapped by the upper fibers of the inferior constrictor. And coming to the inferior constrictor, it is having two parts, thyropharyngeus part and cricopharyngeus part. Coming to the thyropharyngeus part, it arises from the oblique line of thyroid cartilage. We know that on either side of the oblique line of thyroid cartilage we have oblique line here. This is the oblique line of thyroid cartilage. So thyropharyngeus part of inferior constrictor arises from the oblique line of thyroid cartilage here. See here, this is the oblique line of thyroid cartilage. See the thyropharyngeus part of inferior constrictor arises, and it overlaps the lowest fibers of middle constrictor. And coming to the cricopharyngeal part, it arises from the cricoid cartilage as well as the tendinous of the cricoid muscle. And between the thyropharyngeal part and cricopharyngeal part, we have weak areas present because Killer's dehiscence. This weak area, it is up part of the above part of the weak area, it is contributed by all the constrictors of muscle. And coming to the lower part, it is contributed only by the cricopharyngeal part. So that's about the constrictors of pharynx. These constrictors of pharynx which are inserted to the median raphe. And coming to the structures passing in between the constrictors of pharynx. So here we know that sinus of Morgagni is present between the base of the skull and upper border muscle. So it is covered by pharyngobasilar fascia as well as the buccopharyngeal fascia. This sinus of Morgagni consists of, it is pierced by levator villi palatini muscle. Here is the levator villi palatini muscle. It pierces the sinus of Morgagni, and also auditory tube. Important structure is auditory tube. We know that auditory tube, it communicates with the anterior wall of the tympanic cavity to the lateral wall of the nasopharynx to maintain the equilibrium of air pressure on either sides of the tympanic membrane. So that is the auditory tube which passes between the upper border of muscle and the base of the skull. Auditory tube, levator villi palatini, and ascending palatine branch of the ascending pharyngeal artery, and ascending palatine artery which is a branch of the facial artery. These are the structures we can see in the sinus of Morgagni. So sinus of Morgagni gives passage to 4 structures. One is levator villi palatini muscle, next one is auditory tube, and also ascending pharyngeal artery which is a branch of the first branch of the external carotid artery, and also ascending palatine artery which is a branch of the ascending palatine artery which is a branch of the facial artery. These 3-4 structures pass through the sinus of Morgagni. And coming to the structures passing between the middle constrictor and superior constrictor. So from the middle and superior constrictor, structures passing between the middle and superior constrictor, one is important is stylopharyngeus muscle. Stylopharyngeus muscle is the longitudinal muscle of pharynx, and next one is glossopharyngeal nerve. So the glossopharyngeal nerve and stylopharyngeus muscle, they pass in between the superior constrictor and middle constrictor. And coming to the structures passing between the middle and inferior constrictor, we have internal laryngeal nerve and superior laryngeal vessels. Superior laryngeal vessels and internal laryngeal nerve, they pass in between the middle constrictor and inferior constrictor. So this is the middle constrictor and this is the inferior constrictor. Structures passing between the middle and inferior constrictors are the internal laryngeal nerve and superior laryngeal artery. And coming to the structures passing below the inferior constrictor are inferior laryngeal artery and recurrent laryngeal nerve. Inferior laryngeal artery and recurrent laryngeal nerve, they pass below the inferior constrictor. So these are the structures passing in between the constrictor muscles. Above we have levator villi palatini, auditory tube, ascending palatine artery, and also ascending pharyngeal branch of the external carotid artery. They pass with the sinus of Morgagni above the superior constrictor. Below the superior and middle constrictors, we have stylopharyngeal muscle, and also we have glossopharyngeal nerve passing in between them. And between the middle and inferior constrictor, we have internal laryngeal nerve. Here I have represented the nerve with green color. See the internal laryngeal nerve and also superior laryngeal artery. And between the cricopharyngeal part of the inferior constrictor, below the cricopharyngeal part of the inferior constrictor, we have inferior laryngeal artery and recurrent laryngeal nerve. They pass below the cricopharyngeal part of the inferior constrictor. These are the structures passing in between the constrictor muscles. And all these constrictors, they are supplied by the cranial part of accessory nerve. All these cranial part of spinal accessory nerve. All these constrictors, they are supplied by the spinal accessory nerve. And also the inferior constrictor muscle, in turn, it is supplied by the external laryngeal nerve and also recurrent laryngeal nerve. The inferior constrictor muscle, it receives an additional supply from the external laryngeal nerve as well as the recurrent laryngeal nerve. So these are about the circular muscle coat of the pharynx. So these are the 3 constrictor muscles of the pharynx. They form the circular muscle coat of the pharynx. So coming to the longitudinal muscle coat of pharynx. So longitudinal muscle coat of pharynx consists of three muscles. One is salpingopharyngeus, palatopharyngeus and stylopharyngeus muscles. So salpingopharyngeus muscle, palatopharyngeus muscle and stylopharyngeus muscles. These three muscles forms the longitudinal muscle coat of pharynx. Coming to the stylopharyngeus muscle, the stylopharyngeus muscle it arises from the medial surface of the styloid process. We know the styloid process, it is a part of temporal bone and it is situated here. So this is the styloid process. So the stylopharyngeus muscle it arises from the medial surface of the styloid process. This is the medial. So styloid process it is a part of temporal bone. Okay, so the stylopharyngeus muscle arises from the medial surface of styloid process and it passes in between the superior constrictor and middle constrictor along with the glossopharyngeal nerve. So between the superior constrictor and middle constrictor there exists a gap, and here the stylopharyngeus muscle along with the glossopharyngeal nerve it enters in between this superior constrictor and middle constrictor, and here it forms a conjoint tendon along with the other two longitudinal muscles. They are nothing but the palatoglossus and palatopharyngeus and salpingopharyngeus. So the stylopharyngeus arises from the medial surface of the styloid process of temporal bone and it extends downwards and it enters the pharynx and it passes in between the superior constrictor and middle constrictor along with the glossopharyngeal nerve, and it forms a conjoint tendon along with the other two longitudinal muscles. Those are nothing but the salpingopharyngeus and palatopharyngeus. And this salpingopharyngeus and palatopharyngeus they together form a conjoint tendon and they are inserted to the posterior border of the lamina of the thyroid cartilage. This is the thyroid cartilage. This is thyroid cartilage and they are inserted to the posterior border of the lamina of the thyroid cartilage. And coming to the other muscle, that is nothing but the salpingopharyngeus muscle. We know that salpingopharyngeus muscle it arises by a tubal elevation in the lateral wall of the nasopharynx. In the lateral wall of the nasopharynx we have an opening called auditory tube opening. From the auditory tube opening it is surrounded by an elevation, we call it as tubal elevation. From the tubal elevation two folds extends. One is salpingopalatine fold and this is a salpingopalatine fold and this is a salpingopharyngeal fold. From the salpingopharyngeal fold we have, underneath the salpingopharyngeal fold we have muscle of the same name, that is the salpingopharyngeus muscle. So from the tubal elevation salpingopharyngeus muscle extends downwards and backwards and it unites with the stylopharyngeus muscle by forming a conjoint tendon. So the salpingopharyngeus muscle it arises from the tubal elevation which is present in the lateral wall of the nasopharynx, forming the roof and posterior wall of the auditory tube. On the tubal elevation, we know that we are having tubal tonsil. So, the salpingopharyngeus muscle arises from the tubal elevation. Coming to the palatopharyngeus muscle, the palatopharyngeus muscle it arises by two fascicula. Fascicula means nothing but bundles, anterior and posterior fasciculae. These two fasciculae, they are enclosing the levator villi palatinae insertion. Though the palatopharyngeus muscle, it arises from the palatine aponeurosis by two fasciculae, anterior fascicula and posterior fascicula. These two fasciculae they enclose the insertion of the levator villi palatinae muscle. Here this palatopharyngeus muscle also it extends downwards backwards and it forms a conjoint tendon along with the other two constrictors in the similar way, and it is also inserted to the posterior border of the lamina of the thyroid cartilage. Okay, so here some of the fibers of the palatopharyngeal muscles they sweep horizontally backwards behind the pharyngeal mucosa, and here they form one ridge called Passavant's ridge, and they also form palatopharyngeal sphincter. Some fibers of the palatopharyngeus muscle they sweep backwards horizontally without inserting into the posterior border of thyroid lamina. They sweep backwards and form a sphincter called palatopharyngeal sphincter which closes during deglutition. This palatopharyngeal sphincter which closes during deglutition. So these are the three longitudinal muscles of pharynx. So three longitudinal muscles are, one is stylopharyngeus arises from the medial surface of the styloid process of temporal bone, and next one is salpingopharyngeus which arises from the tubal elevation And the third one is palatopharyngeus muscle, which arises from the palatine aponeurosis by two fasciculae by enclosing the tendon of levator villi palatine. All the three muscles, they form the conjoint tendon and they are inserted to the posterior border of the lamina of the thyroid cartilage here. And some fibers of the palatopharyngeus muscle, they sweep backwards without inserting into the posterior border and they form palatopharyngeal sphincter. So this is about the longitudinal muscle coat of the pharynx. These longitudinal muscle coats, they elevate the larynx and shorten the pharynx during deglutition. What is the action of the longitudinal muscles means? They elevate the larynx and shortens the pharynx during deglutition and closes the palatopharyngeal sphincter. So that is the action of the longitudinal muscles of the pharynx, nothing but the palatopharyngeus, stylopharyngeus and salpingopharyngeus. And coming to the action of the circular muscles of the pharynx, that means nothing but superior constrictor, middle constrictor and inferior constrictor. They contract reflexly induce a movement of paralysis in a caudal manner. They contract reflexly and induce a wave of peristalsis in a caudal manner. And one more thing is the thyropharyngeus part of inferior constrictor is propulsive in action, whereas the cricopharyngeus part of the inferior constrictor, it acts as a sphincter and it remains closed except during deglutition. So the cricopharyngeus part acts as a sphincter. The thyropharyngeus part of the inferior constrictor, it helps in propulsive action. And coming to the longitudinal muscle coat, this longitudinal muscle coat, they elevate the larynx and shortens the pharynx and they close the pharyngeal isthmus by the help of palatopharyngeal sphincter during deglutition. So that is the actions of the constrictor muscles. The constrictor muscles, they contract reflexly and induce a wave of peristalsis in a caudal manner. So those are the actions of the constrictor muscles as well as the longitudinal muscle coat of pharynx. And coming to the nerve supply, all the muscles of pharynx, they are supplied by the cranial part of accessory nerve through pharyngeal plexus. All the muscles of the pharynx, they are supplied by the cranial part of accessory nerve. So accessory nerve is the 11th cranial nerve. They are supplied by the cranial part of accessory nerve, except stylopharyngeus, which is supplied by the glossopharyngeal nerve. So only the glossopharyngeus, so stylopharyngeus only it is supplied by the glossopharyngeal nerve. Remaining all the three constrictors and the remaining two pharyngeus muscles, that is palatopharyngeus and salpingopharyngeus, they are supplied by the cranial part of accessory nerve through pharyngeal plexus, except stylopharyngeus, which is supplied by the glossopharyngeal nerve. So, and also the inferior constrictor muscles, it receives an additional nerve supply by the external laryngeal as well as the internal laryngeal nerves. So that's about the motor nerve supply of the pharynx. And coming to the sensory nerve supply of the pharynx, sensory nerve supply. So the nasopharynx, it is supplied by the pharyngeal branch from the pterygopalatine ganglion, which carries the fibers from the maxillary nerve. Sensory nerve supply of the pharynx, sensory supply. Nasopharynx by the pharyngeal branch from pterygopalatine ganglion. Pharyngeal branch from the pterygopalatine ganglion. And oropharynx, it is supplied by a branch from the glossopharyngeal nerve. It is supplied by the branch from the glossopharyngeal nerve. And laryngopharynx, it is supplied by a branch from the internal laryngeal nerve. Internal laryngeal nerve. So the sensory nerve supply, nasopharynx, it is supplied by the pharyngeal branch of pterygopalatine ganglion, which carries the fibers of the maxillary nerve, and the oropharynx, it is supplied by the branch from the glossopharyngeal nerve, and laryngopharynx, it is supplied by the branch from the internal laryngeal nerve. That's about the sensory nerve supply. And coming to the pharyngeal plexus, it is formed by a branch from the superior cervical ganglion. Pharyngeal plexus, we can see the pharyngeal plexus on buccopharyngeal fascia. We know that buccopharyngeal fascia, it is a loose areolar membrane covering the constrictors of pharynx, right? So the pharyngeal plexus, it is formed by branch of vagus nerve, branch of vagus nerve, and a branch of superior cervical ganglion, and a branch of pharyngeal branch of glossopharyngeal nerve, and a pharyngeal branch of external laryngeal nerve. These forms the pharyngeal plexus. So the pharyngeal plexus, it is formed by pharyngeal plexus. We can see it in the buccopharyngeal fascia, which is formed by the pharyngeal branch of vagus, pharyngeal branch of glossopharyngeal, pharyngeal branch from the superior cervical ganglion. This forms the pharyngeal plexus or the buccopharyngeal fascia. And coming to the arterial supply of the pharynx, it is supplied by the ascending pharyngeal artery, which is a branch of external carotid artery, which is the first branch of external carotid artery, and also it is supplied by the tonsillar and palatine branches of the facial artery, and also it is supplied by the dorsal lingual arteries, which are the branches of the lingual artery, which is in turn is a branch of external carotid artery. It is also supplied by the branches of the maxillary artery, pharyngeal artery, pterygoid branches of the maxillary artery. These all together supply the pharynx. And coming to the veins drain into pterygoid venous plexus, and further they drain into internal jugular veins. So that's about the pharynx. So pharynx, it is having three parts: oropharynx, nasopharynx, oropharynx, and laryngopharynx, and they are having some boundaries. And coming to the muscle cord, we are having circular muscle cord and longitudinal muscle cord. Circular muscle cord consists of constrictors, and outer longitudinal muscle cord consists of pharyngeal muscle, and we are having these constrictors are covered by fascia called buccopharyngeal fascia, and below the longitudinal muscle cord we have a thick fascia, we call it as pharyngobasilar fascia is seen. Pharyngobasilar fascia we can see at the sinus of Morgagni, and it is pierced by the levator villi palatine auditory tube, as well as ascending pharyngeal artery, as well as palatine branches of the facial artery. So that's about the blood supply, nerve supply of the pharynx, sensory nerve supply of pharynx. So that's the end of the pharynx.